All right, welcome back, everybody. As we learn to live with the persistent spread of COVID-19 in Connecticut and nationwide, the pandemic's repercussions will likely be evident for years to come, including many people working remotely.
Sure, it offers greater flexibility, but it could also contribute to an increased risk of back pain. So joining us now to discuss all this is Dr. Russell Amundsen. He's a neurosurgeon and the National Medical Director for United Healthcare. Welcome, Doctor.
Hello, thanks for having me.
It's our pleasure. All right, so what should people be aware of as it relates to remote work and back pain?
Well, about 45% of Americans are now working from home, either part-time or full-time. They're probably not working from an ergonomically designed office. They may be sitting on the couch, even in bed. And with that, there's lack of support, and research has shown that there's an increase in back pain as a result of this post-pandemic work from home trend.
And so what do you think people should do and keep in mind about their posture? I mean, are there things that we can do to prevent it?
Absolutely. What we want to do is engage our core. So think of those core muscles that can help support you. Keep your head square, shoulders back, hips and knees square at right angles. If you're working at a desk, keep your arms level so you're not stressing the wrists while you're typing, and try to have your screen at eye level so you're not straining your neck. And the other thing about the core is those letters: C for correct posture, O for overdoing it or overeating, things you'd like to avoid, R is to relax. Every 30 minutes or so, get up, move around, relax your eyes, relax your mind, and stretch and invigorate your muscles and joints. And then E is to exercise. Some regular low impact exercise like walking, swimming, Tai Chi and yoga are useful. They've actually been shown to reduce pain levels even when they're moderate to severe.
Doc, I'm one of these people who's afraid that if I get up from the computer, somebody's going to notice, and then they're going to get mad at me. I should just stay at my desk and not do anything. But you say take recommended breaks.
It actually is not only good for you, but it's been shown as well to be good for productivity, to step away a little bit and, as I said, give your eyes and mind a break.
Yeah, you know, it's really common, right? The back pain issue?
It is about 80% of Americans sometime during their life will have some degree of low back pain. It's sometimes just a nuisance, sometimes more severe. The really good news is that in 95% of those instances, it's going to get better on its own in about, 12 weeks, 3 months. So a little bit of patience is necessary. Self-care is helpful, and exercises, as mentioned, are useful.
I know we touched a little bit on it, but diet is a big deal when it comes to back pain, right?
It is, of course, as I mentioned, overeating, additional weight puts more stress on the low back, which can contribute to discomfort, but also a well-balanced diet with appropriate use of hydration will keep you healthy and can reduce inflammation. And inflammation does, over the long term, contribute to some of the conditions leading to low back pain.
So the pizza truck that we have coming up at the end of the show wouldn't be recommended.
I'm not going to go there. I'm sorry.
But afterward, you know, a lot of people, after the pizza truck, you might want to exercise. People with low back pain will often say, oh, I can't exercise, I can't do anything because I have pain. Is rest really the best, or can activity actually make it better?
It's best to stay active within your comfort zone. Again, not to overdo it, but the more you rest, sometimes things get stiffer, and then that stiffness in the muscles becomes a source of pain as well.
And we also need to be careful.
So keeping active is good.
Okay.
Yeah, I just also, you know, the way that care is administered, you know, people often don't know what they're supposed to do. You actually say you want people to know that there's some kinds of care that we might want to avoid.
Correct. The things you want to look out for, I mean, to go through it, you have what are called red flags. So if you're having low back pain, and obviously if you've had any trauma or injury, if you're running a fever and there's a concern for infection, or if there's a history of tumor or cancer, those are red flags. And certainly if you've lost any function, sensation, or strength, those are things you want to go to your healthcare provider directly and seek care. Otherwise, the first line therapies really do include physical therapy and chiropractic. And again, there is, through United Healthcare, there are options for some of the members to have a virtual physical therapy program through an app called Kaya Health. And this provides physical therapy level exercises, health coaching, and referrals as as necessary. So it's sort of the flip side, if you will, of this remote work. There's now capability to have remote physical therapy as well.
All right, and if you're home and you're working, try to get an ergonomically correct chair, right? Don't be sitting on a stool for all that period of time.
That's probably a good investment. And if you're stuck at that uncomfortable chair, do your best to, again, engage your core and hold yourself up and support yourself.
I know. Kara's telling me to sit up right here
sitting
on the
up
set.
right
We're sitting
now.
up. We're sitting up,
We need
Doc.
to put our screens eye level. Then we can't see you.
It's harder than you think, and it's hard to sustain it, but it's worth the effort.
I've
No, it
noticed
really
it with
is.
even with kids too, because a lot of it, they're remote schooling or doing their homework. They're in their beds. They're looking like this all the time.
I know.
So.
I know. My trainer's like, get your back, get your shoulders back, and get your core going.
There you go. That's the message.
All right. Well, we can't thank you enough for your time, Doctor. We appreciate it.
Thank you.
For more information, visit uhc.com.
Yeah, some great options to do physical therapy remotely too.
Absolutely,
That's great.
right? Terrific.